This will be phase 2 of the lumbar spine. This is L20. Just to further the table exercises, we started with supine marches. Have the patient laying supine. Just the core is engaged, so nice and tight. Try not to let their neck come up off the table here. The key is just to lift with the leg. Don't let a lot of movement happen at the hip, so it's nice and smooth. Have the patient lift your leg up about 6 inches or so, nice and slow. Then the opposite leg. These are called supine marches. Just nice and slow movements. To advance from that, we have walkouts. So this is also a progressed table exercise for the lumbar spine. Have the patient tighten their core. Walk out nice and slow. Legs are barely straight. And then walk back up. Just walkouts is what these are called. Back to neutral. Rest for a second. Tighten the core again. Make sure they're breathing. Walk back up. And those are called walkouts. The next exercise are single leg bridges. So once again, we'll get in the bridge position. So earlier we did feet shoulder width apart, and to advance that, we'll do feet together. Next would be single leg bridges. So arms just relax, one leg will be straight. Kind of toes are pointed up towards you. You'll lift the hips up. The body's in a straight line. Toes are pointed up, they're not down. Hold that position 3 to 5 seconds, and then relax. And once again, the core is tight, engaged. We'll do it one more time. Lift up, body's in a straight line, toes pointing towards me. I'm not using my elbows. Just relaxed here. And relax. And you would switch legs also. So that's a single leg bridge. Next, we have the abdominal forward crunch and the obliques. We'll have the patient, his feet, legs are bent, shoulder width apart. We would have them cross their hands here. Some patients will do this method. This kind of takes the hands out of it, makes it a little harder. We don't want the patients throwing themselves up. Just cross the arms. The core is tight. We just want to crunch up here towards the top. Hold for about a second or two. Have them breathe out on the way up. Back. 1, 2, back down. That's the forward crunch, and to advance that, we would add the obliques. So we'll just kind of bring the shoulder to the opposite knee here. So crunch, 1, 2, back down, crunch, 1, 2, back down. And that's the oblique crunch there. Next we have the quadruped opposite arm, opposite leg. So we're getting the quadruped position. Alright. So opposite arm, opposite leg. Legs straight, arms straight, looking forward. Hold that position for 5 seconds. And then back to neutral. Switching. Back for 5 seconds. And that's quadruped. And then we also have the front planks. Front planks done on your elbows. You can either start from the knees or use your feet. So this will be from the knees here. Just using my knees. Doing the body in a straight line, core is tight. If you did the feet, body's in a straight line, using the elbows. Same thing, you have the side plank. You go from the knees, pressures to the elbow, body's in a straight line, it's not bent or anything. And then you can also do from the feet. And this can also be done on the lower spine extension machine over here. So another version of the side planks would be on this machine here. You would have them place their foot in there. Alright, so you want to bend up the hips. So we want this position was right below the hips so it's comfortable, nice and comfortable for them. And this is if you have any elbow or shoulder issues. This will prevent having any increased pain in those areas. You kind of have them cross your arms and kind of bend down and hold that position. That's body's in a straight line. You have them hold that position there. So that's another version of the side plank. Next, to finish phase 2, we also have a physio ball. We got seated marches and the straight legs. So they're sitting here, you have their stomach engaged, just marching here, nice and slow movements. Ball is not moving much, sitting nice and tall, just lifting their legs up. And then the straight legs, just have them doing knees bent, toes coming towards you. The ball's not moving at all. Core's engaged. Next would be the wobble board, and that would finish phase 2 of the lumbar spine. I'll move this machine here out of the way for us. Wobble board, got the 2 nubs on there, forward and back. We'll try to hold that, try to balance in the middle for a second or two, have them come forward. Hold for a second and then back. Then we will position the other way, one side to side, same idea, try to balance for a second, and then to the other side. Now we'll finish lumbar phase 2. Alright, the next exercise is the physio ball wall push-ups. Next we will, just any size physio ball, whatever fits for them. You're going to have your hands in this position, almost like you're gripping a basketball. Body will be shoulder, the feet will be shoulder width apart. The body is at an angle, you just have them come towards the ball. Hold for about a second or two, and then push back out. Second or two. To really challenge himself a little more, have him put the feet together, then try it again. And you would progress them closer to the ball and move your feet further and out. And that's the physio ball wall push-up.